This really isn't a change. So if people tested previously positive with an abnormal cytology and a reflex test to high-risk HPV, they went to colposcopy and maybe biopsy, or maybe just a sooner repeat. But all of that cascade of testing really hasn't changed that much. So there's a little bit of nuance, but ASCCP, which is the organization that does this incredibly wonderful app for all of us to make it simple for us to know what to do with these test results, have accounted for primary HPV testing for quite some time.
Okay.
So those algorithms are already in existence. The real challenge, I think, when it was that we needed to see people every year and do the test every year, it was easy to keep track of it. I think creating systems to track which patients need to be followed in a year, which patients need 5-year follow-up. How do you remember as a patient? How do you remember, like, when was my last? And for patients, they mix up pelvic exam and pap smear or pelvic exam and cytology screening. They feel like if they've had a pelvic exam, even in the ER for something, that they've had a pap smear, and that's not true. So we still have a lot of communication to do about what's being accomplished at a visit. And as providers, we have to create some systems that alert us to knowing when to repeat a test for a patient. I love the idea that we allow women to participate in the processes that affect us. And, for decades, if not longer, we've been very authoritarian and hierarchical, telling women what they need to do without asking women what's important to them. And so I think for all processes that we do and guideline development and all of these things, we need to consider the voice of the people who are impacted. And I just love it that was actually done. We think we communicate really well, and we don't. The public will feed back to us and tell us that our language is not understandable and people get confused. And that's the worst case scenario, right? It really is important for us to be able to explain to women the why. Why are we doing this? Why is it every 5 years? Why is it not women who are younger than 30? And I think that's the other piece of this that sometimes gets lost. But for women between ages 21 and 30, this is not the recommendation. And the reason is that's a time in life when people get exposed to a lot of human papillomavirus. And because it's so transient, testing for HPV would result in a lot more of those downstream tests, when in fact, most people's immune system is going to clear it. And so we don't want to capture something that's transient. So very important to recognize that this guideline does not apply to women between ages 21 and 30.